Well, good morning, everyone, and thank you for joining us. Thank you to Elder Radford Black and the drummers, and Elder Jim Swag for starting us off in a good way this morning. And it is my pleasure to celebrate the official opening of the Arthur J.E. Child Comprehensive Cancer Center alongside Minister of Health Adriana LaGrange, Minister of Infrastructure Pete Guthrie, Vice Chair of the Board of Directors of Alberta Health Services, Sandy Edmonston, Chief Program Officer of Cancer Care Alberta, Brenda Hubley, and Patient Advisor, Charlotte Kessler. Of course, Athana Methanopoulos is also here, our CEO of AHS. This is a truly historic day for the province. Not only is this new centre one of the largest government infrastructure projects in Alberta's history, but its opening also puts the province on the path to becoming an international leader in cancer treatment and research. This year alone, more than 23,000 Albertans will hear those dreaded words, "You have cancer." It's expected that more than half of Albertans will develop cancer at some point in their lifetime. As frightening as those numbers sound, today brings good news for those who are living with cancer and the loved ones who care for them. The Arthur Child is a world-class cancer treatment facility that puts the patient at the center of a multidisciplinary health system. It goes without saying that a cancer diagnosis is life-changing, and walking the journey of treatments can be exhausting physically, mentally, and emotionally. Nobody knows that better than cancer patients and their families, what the road looks like. And that's why it was so important that they had a say in this project every step of the way. And that means innovative treatment that will prioritize the patient's experience from diagnosis to discharge. The center's integrated and comprehensive approach to cancer care brings increased capacity, which means that a greater number of Albertans will be able to access the care and the services that they need. And as a world-class research facility, the center's focus on prevention and early detection will lead one day, we hope, to a future without cancer. This facility marks a real milestone for the province. It advances our government's work to ensure that Albertans have access to the health care they need when and where they need it. It reflects our government's commitment to investing in facilities and innovations that enhance cancer treatment. And it aligns with our belief that through research and innovation, a future with better health outcomes for cancer patients, including a cure, is possible. I want to thank everyone who helped to bring the centre from construction to its completion this year, from AHS to the medical professionals to the engineers and architects, and more than 8,700 construction workers who worked on this project. Thank you also to those who generously donated funds that helped turn the vision of a world-class cancer centre into a reality. And thank you to the center's incredible frontline healthcare providers. Your dedication to excellence means that all patients can expect nothing less than the very best in care and treatment. And finally, congratulations. Today's official opening brings us one step closer to better outcomes for cancer patients. With the promise that hope and healing are just on the horizon, I'd like to now turn it over to Minister Adriana LaGrange to say a few words.
Thank you, Premier, and good morning, everyone. Thank you for joining us on what is an incredibly exciting day. Who's excited out there? There's got to be some noise. Hey! This is a monumental moment for the City of Calgary, but also for all Albertans living in every corner of the province. Thank you also to the elders and to the drummers for starting us in a good way. We are here to celebrate the opening of the Arthur J.E. Child Comprehensive Cancer Center, a state-of-the-art facility that offers an extensive scope of services for patients and more than 9,200 square meters of dedicated research space. Soon, patients from across the province will walk through the front doors, seeking the knowledge and the expertise of the Arthur Child's dedicated healthcare team. And I agree with the Premier, we have the best of the best here. So thank you to all our frontline workers. And we know that the patients will be met with the kindness and compassion that they have come to expect from Alberta's healthcare professionals. professionals who go above and beyond, becoming confident and supporting their patients through thick and thin, and building relationships that often go long after the treatment has been completed. We are fortunate to have a world-class team here at the Arthur Child, which is a world-class facility. A team that we hope will continue to grow as we work to attract the talented healthcare workers and researchers over the coming years. I'd also like to take a moment to thank the volunteers and community members who helped to make today possible. I recently had the opportunity to meet with some of the bright and caring minds behind the Own Cancer campaign that raised more than $250 million to accelerate research innovations and provide world-leading cancer care right here at the Arthur Child. Give yourselves a hand. While there are many things that resonated with me during my conversations with the campaign cabinet, volunteers, and donors, I kept coming back to the notion that bricks and mortar are only the beginning. It's really the people that make the difference. While this beautiful facility's capabilities are evident, its impact is what will set it apart. On top of its extensive services, the Arthur Child will bring something intangible: hope. Hope for the patients who will soon receive treatment and care from a dedicated team of practitioners. Hope for groundbreaking research and breakthroughs that will make a real difference. Hope for future clinical trials. Hope for improved personalized support for patients and their families. And hope for a future without cancer. This is what we are all working towards, a future where, through research, innovation, education, and skilled professionals, we see fewer cases of cancer in our communities. A future where early detection becomes the norm and screening opportunities are easily accessible no matter where someone decides to put down roots. We recently announced a new mobile lung screening program for rural and remote communities in partnership with the Alberta Cancer Foundation and 19 to 0, which we hope will have the same success as Screen Test, our mobile breast cancer screening program. And I don't know if you know that that's been in existence for about 30 years already here in Alberta. These programs save lives, and the work that will go on in this facility will save lives. We all know someone who has been affected by cancer, and every loss is one too many. I was only 7 years old when my father was diagnosed with cancer, and I was 15 years old when he passed away from cancer. And my younger sister was only 29 when she died of cancer as well. Cancer doesn't just affect the person, it affects the whole family. And I know that all of you know that as well. We owe it to ourselves, to our children, our loved ones, and the future generations that come after us to do whatever we can to prevent cancer cases and to improve treatment and outcomes. As a cancer survivor myself, you have my commitment and our government's commitment that we will keep doing what we can to improve health outcomes for all Albertans. So once again, I sincerely thank you all. And I'd like to invite Pete Guthrie, the Minister of Infrastructure, to come and say a few words.
Well, good morning, everyone. Thank you for joining us. I'm very happy to be here this morning, joined by Premier Smith, Adriana, LaGrange, and the entire team at AHS to share this exciting news with you. This is a significant day for Calgary and for all Albertans. And as you just heard, our province is now home to one of the most advanced cancer care facilities in the world. And the opening of the Arthur J.E. Child Comprehensive Cancer Care Centre brings hope, optimism, and a wide range of specialized health services for cancer patients, their families, and their loved ones. And I'm immensely proud of the work that went into this monumental task of planning, designing, and building this $1.4 billion facility. Since the beginning, the goal was to deliver a state-of-the-art health facility, which would turn out to be the largest undertaken by Alberta at the time. We had engineers, architects, patient and family advisors, and medical professionals all collaborating with Alberta Infrastructure, Alberta Health, and AHS to transform this idea into reality. And together, we designed and created a building filled with natural light and innovative features to cultivate an environment of reduced stress and promote well-being and foster hope for patients as well as for the people who care for them. This cancer center will not only enhance cancer care programs and services, it will also serve as a central hub for medical education and research. In fact, more than 99,000 square feet, or about 5% of the total footprint, has been allocated for leading-edge cancer care research initiatives. And since the start of construction, this project has been a major economic generator for the province, generating more than 8,700 construction and construction-related jobs, and generating more than 8 million hours worked on site. Projects like this one create significant long-term impacts for our communities by supporting jobs, stimulating local economies, and attracting investment into the province. But first and foremost, the Calgary Cancer Centre offers hope through its life-saving services and its top-quality medical professionals. And with that, I'd like to invite Sandy Edmonston to come to the podium and say a few things.
Thank you for your introduction, Minister Guthrie, and thanks to Premier Smith and Minister LaGrange for sharing in this exceptional day. Together with Athana Mentzelopoulos, President and CEO of Alberta Health Services, and on behalf of the AHS Board of Directors, I thank you all for joining today in this celebration. We are incredibly proud of today's Arthur J.E. Child Comprehensive Cancer Center grand opening. This day has been long anticipated for our patients and our healthcare providers, for their family members and support networks. And for all Albertans, we proudly lead the way in cancer care, research, and treatment. We stand in a truly extraordinary space, and this building enables us to provide world-class health care for Albertans facing cancer. This facility is one of the largest comprehensive cancer centers in the world and is 7 times the footprint of the Tom Baker Cancer Center, which gives us room to grow and provide Albertans cancer care for years to come. The new center contains 160 inpatient beds, more than 90 chemotherapy chairs, 12 radiation therapy vaults, and it will allow medical research and clinical care under one roof. The facility boasts more than 66,000 square feet of outdoor accessible space, a ground floor outdoor garden, and an 8th floor green space with public access, creating a calming and fresh environment that is therapeutic for patients, their families, and staff. Moreover, the facility reflects the people at the heart of it. Every design decision, you see feedback from patients, families, visitors, and staff. We wouldn't be here today without the support of many individuals and organizations. First and foremost, patients and their families. You're at the heart of all we do. And our care providers, who are the soul of this building. To the AHS leaders who have tirelessly advocated for and led this project. Thank you to Brenda Hubley, Chief Program Officer, Cancer Care Alberta, Dr. Dean Ruther, Senior Medical Director, Cancer Care Alberta, Caroline Hatcher, Executive Director, Tom Baker Cancer Center, Dr. Dawn Morris, Associate Senior Medical Director, and Jody C. Rip, Director of Operational Readiness. Additionally, I also extend immense gratitude to the Alberta Cancer Foundation and the University of Calgary for their extraordinary fundraising efforts. Together, these two organizations embarked on the Own Cancer campaign for the Arthur Child. This $250 million campaign is the largest capital campaign for healthcare in Alberta's history and will ensure this facility is equipped with the best resources for years to come. Finally, to the Government of Alberta, your $1.4 billion investment in the Arthur Child is truly transformational and benefits all Albertans. The government's commitment and vision deserve significant acknowledgement and recognition. Thank you to Her Excellency Premier Smith and her team for delivering something no other government has. We are honored to be stewards of your investment and to be at the forefront of cancer care. I'd like to invite up to the podium the leader of our cancer care teams for a few words, Brenda Headley.
Thank you so much, and it's so wonderful to see so many of you here today. You've heard the word monumental several times. It's not just because of the size of this amazing facility. It's monumental because of this day and what's going to happen after this day and the future for cancer care in Alberta. Thinking back to the groundbreaking for this building and witnessing its transformation over the past 7 years is truly awe-inspiring. This new cancer center is a testament to the collective vision and dedication of so many people. But I particularly want to recognize our patient and family advisors, many of whom are here today. Their invaluable insights have shaped the design of this remarkable building and space, a design that truly reflects the heart and reason why we're here today. More than just a building, the Arthur Child is a place where cutting-edge research, world-class clinical trials, and exceptional patient care all exist under one roof. That's remarkable. It's a place of hope, a place of possibility, a place where medical innovation, clinical expertise, and compassionate care will come together and bring to life our shared and unwavering commitment to transform cancer care. This is a place where our commitment to research and innovation will fuel advancements in cancer care, and a place where our commitment to patient-centered care will empower our patients and families to be partners in their care and support them in maintaining control over their lives while dealing with a cancer diagnosis and beyond that diagnosis. I want to express my sincere gratitude to those who have dedicated their time and energy to this project over the past 7 years. A special thank you to the many teams, not the least of which is our Cancer Care Alberta team, staff and physicians, for your dedication and hard work in making this center a reality. I also want to recognize and thank the Alberta Cancer Foundation, the University of Calgary, and the OWN campaign for their generous support in creating the ability for the community to be part of the opportunity that the Arthur Child holds, and helping us to bring our shared vision for the Arthur Child and cancer care to life. I know the Arthur Child will serve as a catalyst for healing, a symbol of hope, and a testament to the enduring spirit of all who are impacted by cancer. Now, I'm very proud to introduce just one of those individuals who exemplifies that spirit, Charlotte Kessler. Charlotte has tirelessly volunteered her time as a patient advisor even before the groundbreaking and the announcement of this building. Her passion and dedication and continued drive are an inspiration to all of us. Please welcome Charlotte.
If I can, I'm going to need a little extra strength, so I'd like to call my daughter Ashton up to come help me. Hello, I'm Charlotte Kessler, member of the Patient and Family Advisory Council for the Arthur Child Comprehensive Cancer Centre. When I stepped into our first meeting on September 17th, 2014, I had no idea what to expect. I just knew that I was at a point in my own brain cancer journey that I needed to find some positivity in all of the challenges my young family and I were experiencing. I had no way of knowing how much the incredible PFAC members, past and present, would give of themselves. Yes, their time, but their hearts and their souls, their joy and their tears, the rawness of their honest experiences. How much all of this would impact not just this project, not just this building, and the care provided within, but me and my life. These people are inspirational, each in their own way, and I am so fortunate to have gotten to work with each of you on such a momentous project. We are family, and this center is our baby. We look forward to all of you getting to know it. I had no way of knowing that our first co-chair, the late Rebecca Morledge, would lead with such passion, drive, and intense belief in all that we could accomplish. I did not expect it when in 2016, she asked me to put my name in to take her place as co-chair so she could spend more time with her young family, Virginia and Will, who are here today. I made the decision to say yes, and I'm so fortunate that I did. Her influence and faith in me would continue to guide and inspire me through the next 7 years as I helped to co-chair this project through the design, construction, and operational readiness phases. I had no way of knowing the extensive lengths the staff involved would go to not just listen to our wants, needs, hopes, and dreams, but to bring them to life. The hope, the light, the welcome, the heart, the embrace, and so many of the little touches this center provide that set it apart have come from us working so hard together. I had no way of knowing that in 2023, cancer would once again come to challenge my young family. This time it was my husband Ryan who would be diagnosed. I had a good idea the impact his multiple myeloma diagnosis would have on us, and I wanted to be there for him and our amazing daughter, Ashlyn, both of whom had been and are my rocks through my ongoing cancer experiences. I thank Nashrin Mitha for stepping up as co-chair and getting us over the finish line with a flourish. And now, a decade later, I'm standing here today in front of all of you as we were about to cut this ribbon, knowing all these things, that I am forever changed. I will be forever grateful for these experiences, these people, this center. I take pride in knowing that the remarkable care, supports, and especially the revolutionary research and treatment options the center will provide to cancer patients and their families will improve outcomes and lives for so many, including my own husband and our family as we make our way through his cancer journey. I'm able to stand here with full confidence and say that we have and we will continue to improve the lives of Albertans facing cancer for decades to come. Welcome to Arthur Child Cancer Centre, our baby, now everyone's.
Thank you, Charlotte. We'll now move to the ribbon cutting portion of this event. So with that, I'd like to invite our patient advisors and our speakers to the front for the ribbon cutting. Wonderful.
That's one heck of a pair of hedge trimmers. Thanks, guys. Really appreciate it.
Thank you, everyone. We'll now move to the media portion of this event. So it'll be one question, one follow-up. If the media could state their name and outlet for the record, that would be appreciated. And we'll start with those here in the room, if there's anyone lined up.
I bet, yeah, no, completely.
Michael, you can go ahead. Yeah.
Perfect. For the minister, if we could, Mr. Adriana LaGrange. The latest information we have from the Alberta Medical Association is that the wait times for a medical oncologist are somewhere in the 8-week range. I was wondering if that falls in line with what you're seeing here and how this new facility is going to help address those wait times.
Well, certainly making sure that we have a facility that can address the needs of cancer patients now and into the future. We know that we need more oncologists. I know that AHS is actively recruiting more oncologists and making sure that we have individuals that are able to get their diagnosis and treatment within clinically approved times is critical. So that is going to be a focus not of just this facility, but all of cancer care across Alberta. So we're working actively to make sure that that happens.
From an operational standpoint, how quickly do you expect to fill these 160 beds? Is it going to be able to handle full capacity as soon as we start seeing patients here?
Well, you know what? That's an operational question. I think I'll turn it over to Brenda. Would you be able to answer that, Brenda?
This facility has been built for growth into the future, so we won't be opening all 160 beds immediately, but we will be opening for clinical service and moving through very rapidly into expanding access here and filling and providing all the services that have been planned shortly after opening.
Great. Next question, go ahead.
Edward from City News. My question is also for the Health Minister. On oncologists, the AMA has warned as well too, since our province is rising, the population is growing, and our wait times are also getting worse as well too. We need to not only hire more, but also give oncologists pay raises as well too. Do you necessarily have a net number in terms of how many new oncologists have been hired in the province this year so far?
Well, you know what? I don't have that exact number at hand, but I do know that we're actively recruiting to make sure that we have not just the capacity for now, but for into the future as well, because we do know we're growing quickly as a province. We've been able to welcome almost 300,000 people in the last year and a half, 2 years alone. And certainly as we age and as we grow as a province, we will see more incidences on a per capita basis. That, you know, that's just the reality of growing. But we will make sure that we are going to have what we need for now, but also into the future. In terms of negotiations, we have ongoing negotiations with many of our healthcare professionals, and we want to absolutely make sure that they're compensated appropriately. We want to attract the best of the best here in Alberta. We've been very successful thus far. I think this facility is going to be a magnet for people who want to practice in a state-of-the-art facility, unlike any other in North America and I dare say the world. So this will certainly be a draw to some of the best of the best.
Sure. I'll just add, because I noticed in my notes that they had provided me with some of the answer to that question. So let me see if I can quickly find it here so that you, from September 1st, 2023 to August 31st, 2024, there were 10.9 full-time equivalent oncologists and 5.1 hospitalists hired. Those percentage points is just denoting part-time work. An additional 14.8 full-time equivalent oncologists and 6.97 full-time equivalent hospitalists have start dates in the near future. So part of it is the staging, getting the facility open, and then bringing people in. So a total of 202 full-time equivalents have been hired, excluding casuals, between September 1st, 2023 and August 31st, 2024. They're not all new positions, but they're predominantly replacement positions. And one of the things that we have heard is that the fact that we're going to be able to offer the research capacity, that is one of the things that will attract oncologists. If they can enroll their patients in clinical trials so they can be on the cutting edge of medicine, we're very optimistic that we'll be able to attract more oncologists now that we're open. The other thing is that I noticed Ed McCauley is here from the U of C. We probably have to talk to our universities as well about how we graduate more oncologists. I believe, especially since we're seeing the aging population, the increase in not only cancer diagnosis but cancer survivability. That means that I think we need to even be graduating more of those specialists. So that'll require a conversation with our universities to be able to execute on that too.
And the AMA specifically points to pay as to a reason why oncologists are leaving Alberta, even residents as well too. They're leaving Alberta to work in other provinces. I know the province has increased pay for resident physicians, but in terms of oncologists though, the AMA still says their pay is lacking compared to other provinces. They're leaving to BC, they're leaving to Ontario. Is there a timeline? Is there specific dates that we can see where oncologist pay can increase so we can fill spaces like this with more oncologists?
Well, look, I think it's a combination of factors. We want our physicians and our specialists to be well paid. We want to be able to offer a competitive package. I think the research aspect is going to be very important to attracting. We also have one of the best tax environments in the country. None of sales tax. We've got some of the lowest corporate taxes, which matter to those who set up shop as specialists. We also have the low tax for personal income tax. And so I would say that whole tax picture allows for us to be very competitive in inviting people and getting them to accept. But I have heard from those who are in the cancer field that the fact that we're offering 9,200 square meters, I believe it is, of research space, that is going to be very influential in allowing those doctors to be able to not only practice medicine but also be on the cutting edge of research. And I think that's important that we're able to offer that.
Great. Next question.
This is either for the minister or the premier. The latest statistics from the government show a 4.5% increase in the number of physicians in our province. But do you know how many of those have either reduced their practice or are working part-time or are semi-retired? And where would you like to see that number be in the future?
Well, we've seen an increase of over 500 physicians registered to practice in the province, of which I know I believe the number is 286 are family physicians. Obviously, we have a high need in that area, and that's a great news story. The ability to have settled or very close to settling the contract with the resident physicians, resident medical students has also encouraged us, because we know that we have a young population of doctors who want to practice in Alberta, and they're quite excited. They are really excited. Some of the bursary programs. We need physicians, whether they're specialists or whether they're family physicians, right across the whole province. As I said earlier, we're growing, and we need to make sure that we have that capacity. But right now, the greatest need is in the family medicine area and rural generalists, particularly our rural remote locations.
And it is part of the reason why we're opening medical spaces at both the University of Lethbridge as well as in Grand Prairie, because we know that if we can train doctors in rural communities, they're likely to set up practice in rural communities. And our intention is to have a strong encouragement for those docs to get into primary care. So I believe we're starting with 30 students a year, ultimately growing to 50 students a year in each facility, 100 in total, which will make a big difference. And then also nurse practitioners. That was another thing that we heard, is that doctors are very highly trained and have the ability to have joint practices, to not only have a patient panel, but also work as hospitalists. And we want to be able to encourage docs to be able to have both of those streams. But that means that we also have to invite in other health professionals. So that's why we announced the nurse practitioner payment model that also encourages nurses to locate in more rural and remote communities, take on 900 patient panels, and I believe we've had expression of interest from over 100 nurse practitioners. So I think that part is going to grow as well.
Thank you for that. But getting back to the root of my question, in the increase that you saw over the last year, do you know how many of that increased number are actually practicing full-time, part-time, or are semi-retired, or have reduced the number of patients that they see on a daily or weekly basis?
These are net new, though not.
Well, look, I mean, we can get back to you with those numbers. I mean, I don't know what you would call part-time because the practices have changed. I mean, 20 years ago, doctors would have 1,500 patient panels. That's not common today. And so part of our model that we're putting forward is try to encourage doctors to have 500 patient panels. And so if that's your definition of what full-time is, because that's how we're looking at it, because we know that they do have other practices that they're doing, we can get those numbers for you, because we also have an idea of how many doctors are practicing less than that. Did you want to comment?
Yeah. And I would also say these are new practitioners that are coming to the province. And so new practitioners, my experience in talking to them, they want full-time work. They're looking to do full-time work. As Premier said, some of them also do other, they practice in the hospital as hospitalists, or they do other research work, et cetera. So there's any number of combinations of what they may be doing. But I know of that over 500 number, the 286, at least the last number I was given, are family practitioners looking to work in family medicine. And that is a great news story. I also know that from Stats Canada that we are above the Canadian average in terms of per doctor, per family doctor, per capita. Canada is at 83% and we're at 85%. And so that's also a good news story. We'll continue to make sure that number continues to grow. We'd like to see that number 100%. We believe that every Albertan deserves to have the ability to have a family practitioner and a family home, health home. So that's what we're going to strive to that 100% mark.
Thank you. One quick technical question, I would think not for either of you. I just would like to know what's going to happen to the Tom Baker Cancer Centre when this opens.
It's a well-loved centre, and it's actually going to have a bit of a facelift as well, because there will be a cyclotron that's going into the centre. Brenda, do you want to address that, or maybe a Thanom?
Yes, the Tom Baker Cancer Centre has been a well-loved centre. That space is going to be repatriated back into the zone to be able to be repurposed and used, and the new radiopharmaceutical centre will be built adjacent to that space as well. So it will not go vacant.
Great. We're just going to take a break and go to the phones. Operator, can you put through the first caller, please?
Your next question comes from the line of Lisa Johnson with the Canadian Press. Please go ahead.
Hi, good morning. Congratulations on the official opening. I'm wondering if I can just ask a question about the announcement you made yesterday, Premier, about the continuing care moving under Minister Nixon. You mentioned that you hope to see an Uberizing of services in continuing care. And I'm hoping you can provide a little bit more detail about that, and if you could explain how that might be different. I know you mentioned the aim is to create a platform that connects people who need services with providers. How exactly will that be different from the continuing care facility directory that AHS has online right now?
Well, look, I mean, one of the things that we have heard is that it can be difficult for a patient to be able to, or a family to be able to navigate a system and find out where open spaces are. We've heard from our various nonprofit and private providers that some facilities have as many as 35% of spaces open. And so we want to be able to make that transparent, make sure that all of the services are posted so that there is a navigator option for us to be able to find those open spaces, whether it's a navigator within the hospital system, within senior community and social services, or a family on their own. The main approach that we want to take is what we've seen is that we have a large number of alternative level of care patients at any given time that are in acute care beds in hospitals. It's somewhere around 1,500. We have about 1,800 individuals who are awaiting placement, who are living in community and need to have an appropriate home. So we're probably at least 3,500 spaces behind in being able to keep up with that. And at the Continuing Care Association meeting yesterday, they said we probably need to build 12,000 spaces by 2030. When we work in partnership with nonprofit municipalities and other entities, we're able to accelerate that build. So that's the reason why Minister Nixon is going to be taking the lead on that. He does that kind of work in all of the other types of assisted living he provides, and it just makes sense, since we have an acceleration we need to do, that we would move that over to him and then make it easier for patients to navigate the system.
Lisa, do you have a follow-up?
Yeah, thank you. So it sounds like you're saying the existing continuing care facility directory isn't comprehensive enough and needs improvement. My second question is also in regards to that Uberization comment. The labor force employed by Uber is very unique and different from that of AHS or really a lot of publicly funded institutions. Are you planning to change the employment structure to make, for example, personal care workers, independent contractors, similar to Uber drivers in their employment structure?
I think you're taking the analogy a bit far. What we're talking about is creating a portal so that those who have spaces available can easily post them, and those who need a space can easily find them. I think we've all had that experience of technology making that easier for us to be able to find those services. And so that's what we're looking forward to doing, is to be able to connect the open spaces with the services, with the patients that need them. There's no contemplation of changing the provision model.
Great, thanks. We have time for one more question, so operator, please put through the next caller.
Your next question comes from the line of Kelly Kreiderman with Globe and Mail. Please go ahead.
Hi there. The news release for today's announcement talks about this facility having been completed in 2022. Why did it take 2 years for the doors to be opened?
As you can imagine, there's construction and then there's bringing a facility to life. And so absolutely, we were at a place of levels of construction completion, substantial completion, full completion from a construction perspective. And then Charlotte made reference, there's operational commissioning. We now have to bring the facility to life. We have to bring in equipment, commission that equipment, orientate teams, build out the processes, workflows. It's actually a significant amount of work, and so we always knew that it would be at least a year following the completion of the majority of the construction and completing final elements, and then doing the work to operationalize the facility, and we're very excited to be at that time now.
Kelly, do you have a follow-up? Kelly? Nope.
Hi there. Sorry about that. This question is for Minister LaGrange. Her announcement earlier this week talks about another process the province will be going through for primary care. And I'm wondering if the pace of providing and bolstering primary care in the province has been disrupted by the breaking apart of AHS, and whether that has become a concern, especially as we hear in polls right now that Albertans like the centralized agency that we have now?
Well, the impetus to put forward a primary care Alberta model, in where we have leadership that is focused primarily and fully on primary care, will actually give it the prominence it needs. Up until now, Alberta Health Services, while this hasn't been their prime concern, they have dabbled in it to some degree. They have, a number of individuals that are working on it, as well as some clinics. But for the most part, it's been kind of, and I don't want to make the analogy, but the analogy would be somewhat that it's been off the side of someone's desk. This is actually a pillar that will be focused on primary care. We heard loud and clear through the Modernizing Alberta's Primary Care engagement, which was quite extensive. It is also something that I heard as I went around the province doing the extensive engagements for refocusing, that we needed to have a concentration on primary care. It is the foundation of keeping people healthy and out of hospital as much as possible. It's something that we want to do. We want to do that preventative work, that early intervention work, and that only can be done if we actually focus on primary care. And so it is foundational. I believe what you're quoting in terms of the survey was a survey that was done. This is centralized leadership in primary care, and I believe all Albertans will benefit as a result of it.
Great, thanks, Minister. That does conclude the media portion of this event, but we will be moving on to the closing prayer. So for that reason, I ask me.